Is it normal to have menstrual cramps during pregnancy? Cramps during pregnancy are usually scary, but it is a common symptom throughout pregnancy. Most cramps are not dangerous. In fact, they are just the reaction of the uterus to anything that happens to it. The uterus is a muscle, and the only thing a muscle knows how to do is to contract, and contracting feels like cramps. Cramping typically occurs when the uterus expands, causing the ligaments and muscles that support it to stretch. It may be more noticeable when you sneeze, cough, or change positions. This means that as long as your uterus is stimulated, full bladder, vigorous exercise or more, its natural response is to contract. Even though cramps can sometimes indicate problems, mild and transient cramping early in your pregnancy is usually normal and not a sign of miscarriage. One such pain is known colloquially as lightning crotch. It is a quick, sharp pain in the vagina. Normal cramps. During the first trimester, your body is preparing for the growing baby. These changes can cause cramping that would be considered normal. It is typically mild and temporary. Once you become pregnant, your uterus will begin to grow. As it does this, you'll likely feel mild to moderate cramping in your lower abdomen or lower back. This may feel like pressure, stretching, or pulling. It may even be similar to your typical menstrual cramps. As you progress through the first 2 trimesters, it's possible that you'll experience cramping every now and then. Since the uterus is a muscle, anytime it contracts, there's potential for a little discomfort. This can be caused by a full bladder, constipation, gas, or bloating, which many pregnant women experience. Abnormal cramps. If your cramping is persistent or severe, do not hesitate to call your physician. It's better to check on anything that doesn't seem right rather than ignore something that may be a serious concern. Severe cramping, in particular, should always be investigated to rule out ectopic pregnancy. According to the American Academy of Family Physicians, AAFP, it only occurs in fewer than 2% of pregnancies. However, it is the leading cause of death for women in the first trimester. An ectopic pregnancy occurs when the fertilized egg implants outside of the uterine cavity, and signs typically appear when you're 6 to 8 weeks pregnant. It's most often accompanied by one-sided cramping as well as pain in the neck or shoulder and a constant urge to have a bowel movement. If you think you have signs of a ruptured ectopic pregnancy, go to the emergency room right away because it can be life-threatening. Also, if your cramping seems to be focused on one side of your lower abdomen, call your physician to be on the safe side, even if the cramping isn't severe. If you are having any kind of vaginal bleeding along with the cramping in early pregnancy, you should call your physician. It's possible that you are having a miscarriage. These symptoms don't always mean a miscarriage, but your physician should be able to order HCG blood tests or an ultrasound to figure out what's going on. What should I do for cramps while pregnant? If you experience minor cramping during pregnancy, there are a couple of things you can do for prevention and self-care. Try to sit, lie down or change positions. Soak in a warm bath. Try doing relaxation exercises. Place a hot water bottle wrapped in a towel on the egg. Make sure you get plenty of fluids.